Dear colleagues, welcome to our monthly dialogue. Welcome to our Socratic dialogue with top leaders in cardiology. And you know that the European Heart Journal is a global journal. It's European for sure, but is global. And the contribution from other continents, from America and from Asia and from Australia, are remarkably important for the success of the journal. As you know, dialogues are live streamed in X and will be posted in YouTube. We don't have slides. It's a pleasant conversation with top leaders in cardiology. And today, I'm sure you will enjoy this dialogue because the dialogue will be with one of the most prominent cardiologists in China. The dialogue will be with one of the most prominent cardiologists in the world. I'm grateful to China for many reasons. In particular, because China is the top submitting country to the European Heart Journal. So the contribution, the scientific contribution to the journal coming from China is outstanding. But today will not be just science. We have with us, I will tell you the name in a few seconds. We have with us again one of the most prominent cardiologists in China, who is not only a top scientist, but is a very charismatic and elegant colleague. And I'm sure that you will enjoy this dialogue. Now time has come to reveal the name. The name is Professor Junbo Ge from Shanghai. I will host him with Cecilia Linde. You know, Cecilia's many interesting features. Is not only executive editor of the European Heart Journal, but also president-elect of the European Society of Cardiology. But today is with us to host Professor Ge. Cecilia, can you please introduce our guest?
Thank you, Filippo. It's my honor to present Professor Junbo Ge, who received his doctoral degree in Mainz, Germany, and then was promoted Director of Intravascular Ultrasound at the Department of Cardiology, University of Essen, also in Germany. But in 1999, he was invited to Shanghai, China, to work as a co-director of the Department of Cardiology of Zhongshan Hospital, Fudan University. Professor Ge is now academician of Chinese Academy of Sciences, director of the Department of Cardiology, Zhongshan Hospital, Fudan University, chairman of Shanghai Cardiovascular Clinical Center and Shanghai Institute of Cardiovascular Disease, and Dean of Institutes of Biomedical Sciences, Fudan University. He is also chairman of National Clinical Research Center for Interventional Medicine. Professor Ge is also honorary president of Chinese College of Cardiovascular Physicians, president of Chinese Cardiovascular Association, and past president of Asian Pacific Society of Interventional Cardiology. He is a devoted academic and not only has made great achievements in clinical scientific research, but also in composing textbooks and running journals. He is senior editor of China International Journal of Cardiology and associate editor of Heart. He has been long engaged in cardiovascular disease and created a retrograde wire technique and transmitted live demonstrations to TCT for a routine approach for chronic total occlusion. In 1999, he implemented the green channel treatment concept of acute myocardial infarction, which has been developed to China's chest pain treatment system and covering 5,000 hospitals throughout China and has rescued millions of emerging patients. So with this introduction, please now let me go over to the questions. In our dialogues, we try to share not only important scientific contributions of our famous guests, but we also want to unveil the human side. So let us start with your journey. China is a huge country. Where were you born and where did you study medicine?
So thank you very much, Professor Lin. And actually, I was born in a small town, which in the east part of China, Shandong province. It's a coastal city. Shandong province it now belongs to Rizhao. The city called Rizhao means the earliest city of sunrise. Yeah, I was born in 1962, and I entered medical school by the age of 16 in Qingdao Medical College. After that 5 years study, I have, at that time, I have to pass the examination to do my master degree of medical science. And I went to Jinan. That's now it's by the train, fast train, you need 2 hours. But that time, you need 8 hours at least by the slow train. I finished my dissertation in Shandong Medical College. Now it's called Shandong Medical University. And I passed another exam and to Shanghai. I did my PhD degree for coronary heart disease. And during my study, there was, at that time, we just opened to the Western world. And there was an exam annually. I passed the exam. And during my training of a PhD, and I went to Germany for further study. And in University of Mainz, I finished my MD.
So that's exciting and a brave move it must have been to go to Germany. So what attracted you specifically to cardiology?
Yeah, during my study, I did my dissertation of a master's degree on congenital heart disease. At that time, the training of medical field was not very so sophisticated like today. And the patient with, especially the kids with congenital heart disease, they came to me because of cyanosis, because of heart failure. After diagnostic procedures, I sent the patient to the surgery. The patient with pulmonary hypertension, the consequences of operation is not good. And we do not have, at that time, the interventional cardiology. We are not able to repair the ASCs, VSCs. And a large majority of the patients I sent to the surgery, they died either after operation or during operation. So during that period, I was very upset. I said, hey, what's the purpose of me to study medicine? And therefore, when after I finished my dissertation, and I took the exam to do the coronary heart disease, because at that time we are able to diagnose at least the coronary heart disease. Then I moved to Shanghai. Therefore, in 1987, I changed my direction from a congenital heart disease to this coronary heart disease. Therefore, till today, I'm becoming a cardiologist.
Thank you, Professor Ge, for sharing that moving story. You have also an impressive list of publications spanning from translational cardiology to clinical cardiology, even to epidemiology. Which one of these topics are your favorite?
By such a long journey from Qingdao Medical College to Shandong Medical University to Shanghai Medical University, and my mentor and also my colleagues, they influenced me a lot. and I have becoming more curious to anything. Therefore, if I'm in the clinic practice, if I met something I'm not able to solve, I try to go to the library to see if there is any solutions. I try to discuss with my mentor, with my teacher, and therefore in last years, all the things you see I did actually regarding to innovation. I had about 260 patent regarding all the therapeutics, new devices, new catheters, and valves, and so on. I try to find the question, find the disease which is not able to be solved, and try to discuss and with the engineers to get this problem solved. So if you ask me, my favorite baby, I think the innovations in last years I did, even though I published some paper regarding the basic research, but that's all related to innovation.
Oh, that's wonderful. But just out curiosity, who are your mentors? So you mentioned that you had mentors.
I mean, my mentor in my whole life, lot of we call mentor of teachers, even friend. Any time period, I met anyone, I try to ask them the questions which is confuse me. Now, I think which the one give me the most help is my mentor in Germany. He was when I was first came to Germany. He was in Mainz. He was in Germany. They call Oberst. He was Oberst, and afterwards he became Chefarzt, the chief of cardiology, Raimund Erbel. He himself is also a man who's very innovative, and but my Dr. Vater, I mean, in Shanghai, he is also we can call him. He was academician in the Academy of Engineering in China, and he he was the chief editor of our textbook of internal medicine. In China, all the students we study one book. This book every 5 years renewed. And when I was in the medical college, I studied his book, and this is why in the future I said I want to become his student, and through very strict exam, and I passed. I became his student. He showed me how to be a good doctor, and also, one of my professor, Professor Yang, when I did my dissertation for the master degree, also gave me a lot of teaching point, how to do research, how to be a good doctor.
Oh, thank you. So this was a very positive narrative. But were there also some difficult moments in your career?
Yeah, if you ask me, I think the most difficult time was when I was first in Germany. In the beginning of 1990, I got this grant to study. Before that, I have to say, I translated one of the publication of Professor Raimund Erbel, which was in Lancet regarding aortic dissection. At that time, most of our students, we do not understand English. As a fellow, I translated one of his publication, and I copied this and sent to him. I said, I have the grant. May I come to you? He said, oh, welcome. So, but when I was in Germany, I found it was so difficult. You know, in Frankfurt Airport, I even don't know exit is Ausgang. I only follow the people. I thought maybe they go to the bank to pick up the luggage. I followed them, and when I was out, I understand nothing. Very luckily, one of the fellow from University of Mainz, he took a batch and picked me up and put me in the hotel. And in the first, I mean, 2 or 3 months, I feel it's really very upset. Said, "Oh, I cannot." You know, most people they accept to talk to me. They speak German, and then in the first 3 months, I've like a bland, definite man, and I forced myself to study German, and afterwards it become better. But in that first 2 or 3 months, it's really very, very difficult time for me.
Well, thank you. Now you talked about the difficulties, but then you stayed, and then over time, were you ever tempted to remain in Germany?
Yeah, I think this become because my mentor Raymond Elbow, he was so nice. He took me to his family, and he tried to apply for me this in Germany you call it one permission called Berufserlaubnis. Berufserlaubnis means this profession permission, and he yeah, at that time, they just one new technique, intraluminal ultrasound or intracoronary ultrasound. They bought the device because the new device no one want to take charge of, and he told me maybe you can help us for the imaging, and this gives me the opportunity to start with the new device with the new technique, and therefore on the weekend I did a lot of exams in the phantom, in the experimental study, and in the early days I published a lot. You know, everything is new. Everything you do, you can publish. Everything you do, you can publish. Therefore, in my early days in Germany, especially in University of Mainz, I published a lot of papers, and even during the annual meeting, you know, the meeting every year in Mannheim, the Deutsche Tagung for the Cardiology, and sometimes each year I send 20 abstracts, and they said, "Oh, you are paper maker. You made so many papers because at that time everything is new. I have nothing to do. I need them to see the patient, and I do everything, do the correlation, to the imaging. I can show the people, say, look, this is this." So at that time, yeah, after a year and a half, and I feel happy. I feel something to do. I feel really a valuable time.
Thank you. So, Filippo, would you like to continue?
Yeah, well, it's really an enjoyable conversation. Junbo, in particular, I like what you said about research. Clinical research stems from patients. I think that this is an important message also for our younger colleagues. Research doesn't stem from computers or from reader or from reading, but comes from patient. You visit the patient, and then you identify a question which doesn't have an answer in textbooks, a problem which cannot be addressed using current devices, and this generates new ideas. This is really, you synthesize, summarize very elegantly. This is the essence of clinical research. You stand from the patients, you ask new questions to yourself which are not answered by current knowledge, and you formulate and try to prove new hypotheses. You really summarize this notion very well, and has been an important part of your medical and scientific activity. So thank you for sharing with us this important notion. On the other thing really struck me in your answers was the problem with German. Because when I started, I am Italian, and I started actually my experience in UK. Now, for Italians, it's easier to speak English than for you to speak German. But really, I didn't know English at all when I went to the UK. So was a problem because was a barrier. At our time was really an important barrier. Our younger colleagues are more lucky because at least now we have, for some reason, this common language, which is English, and I think that we are making really a good usage of English. And in China, it's impressive how young generations in particular are catching up very quickly with language. So this is another important aspect of what you say. Now, my question, let's go back to China. The progress of China in the field of cardiovascular medicine is really amazing. In the last 10, 20 years, this transition to some extent from traditional Chinese medicine to Western medicine has been really impressive. Now, my question is cultural. What do you think triggered the interest of Chinese colleagues in Western medicine?
Filippo, thank you very much for the question. Actually, if you let me think regarding this question, actually, Chinese culture or Chinese philosophy, they many take a man as a whole, as a human being. The modern medicine, or what you call Western medicine, maybe they are focused on one disease. I think we have maybe both to join these two concepts together. Maybe it's better for the patient, but sometimes the clinical manifestation, if the disease may be in the heart, maybe the patient will present something else, the symptom. Before I answer the question, another example I want to tell you. You said you were in England for the English, because during my high school we do not learn English at that time, but during the exam, I'm not able to recite these 26 characters of English. By enter the medical college, we study English, and our teacher asked us to introduce ourselves. My name is what? I'm 16 years old, and so on. And I cannot speak one sentence. Then I think how to improve this. So I bought one dictionary, and I try to recite the dictionary. Each day I take one page. Each day I take one page. And after you recite the whole page, and till maybe C, I forget the front pages. I said, no problem. I will finish the book. I bought the same book and to start again. And then one foreign professor, he came to give a lecture, and once he has a interpreter to translate his lecture. But once one word, the interpreter did not know what does it mean. I said, I know this. And he said, why? I said, I know from the dictionary. Therefore, the new generation, now the kids in China, they are for the primary school, they learn English, but at that time we do not able to learn English. Therefore, just as you mentioned, when I was in Germany, I started the same thing, the same process again. I try to get a dictionary from the first page. I recite, what this mean, and afterwards I can speak good German, and by the writing, I got trouble. You had some dusty. I have trouble, but to speak, no problem.
Thank you for sharing with us this complex story. Now, Junbo, let's come back to cardiology. Cardiology in Europe and cardiology in China. What do you think is the best way to combine these two different traditions?
Sure, Filippo, very important question. I think to combine, I think it's important to understand a patient as a whole human being, not one organ. I think in last years we try, especially in China, to combine the traditional Chinese medicine to the modern or Western medicine. For example, if patient develop stroke, if the stroke become because of the brain or because of the heart or because of the thrombosis, I think now we combine this together. I think it's easy to understand, also to manage the patient as a whole. For me, I think I also in the last years to integrate this what we call the Chinese philosophy to the modern medicine to handle our patient. For example, I now for me I do not have many time to spend on each patient, but when years ago after the duty, I would like to stay in the ward to talk to every patient. Some of the information you are not able to get from the your outpatient clinic, but you sit by the bed to talk to the family members. You get very important information to diagnosis and the treatment.
Now, thank you for sharing again. And what about the future of Chinese cardiology? What do you envision? What will be the next targets of Chinese cardiology?
I have to see in the last 40 years, I witnessed the spectrum of the Chinese cardiovascular medicine. When I was a fellow, did my internship. We do not have so many patients with heart attacks. We do not have so many patients with a stroke. But because in last years, the people getting wealthier and the people eat well, we had more patients. They had hypertension, dyslipidemia, obesity, and diabetes. Smoking has not very well controlled. And you see in the last 40 years, we have an explosion of cardiovascular disease. We do not see very far. When I was called as the chief of cardiology, our center was the biggest cardiovascular medical center in South China. We do less than 100 coronary intervention annually per year. When I was called, the whole China, we did 4,800 procedures in 1998. In the year 1999, we did 8,000 procedures, PCI. In the year 2000, we did 12,000. In the year 2001, we did 16,000 cases. You see, in last 20 years, every year, the increasing rate about 20 to 30%. In the year 2024, last year, we have more than 2 million procedures performed annually. Therefore, we do see now in the middle and the west part of China, the disease, the atherosclerotic disease, still increasing dramatically. So you ask me the future of cardiology. I think we have really to go to the upstream to put prevention first. If we do not stop these risk factors, people getting, we do see now the patient get myocardial infarction in the age of early 40s or 30 years old. We now try to educate people to have a life or healthier lifestyle, to get rid of smoking and control the body weight, and for the physical exam to check the blood pressure and so on. I think this should be the future. Otherwise, the hospital become bigger and bigger and bigger, and the queue longer and longer and longer. So I think the key to solve is the upstream prevention. And we do see a lot of patients with end stage of this heart disease, with heart failure. And in our emergency, in our CCUs, a lot of patients with develop heart failure. I think the upstream cardiomyopathy or ischemic cardiomyopathy was not very controlled.
Okay, so prevention is better than treatment. This is particularly true also in China. Now, public funding is important in Europe and I think also in China. Do you think that public funding will follow in this direction? What is your expectation?
Sure. I think the answer is yes. I think the funding, public funding, to ask researchers, especially the first line physicians, to try to find the problem, solve the problem, and this is the way to get to the target. Funding is to try to find a question, to solve the question, to find the answer. I think public funding is very important, especially help us for basic research, and clinical trials are also important.
Thank you very much. I'm sure Cecilia, in the meantime, is thinking of other questions. Cecilia, please.
Thank you, Filippo. Yeah, let's now shift the page and focus on another great achievement. You are chairman of the largest cardiology congress in China, the Oriental Congress of Cardiology. How did this fascinating story start? And what is your personal contribution to the history of this important event?
Thank you very much. Actually, in the year, I think 2005, that means 20 years ago, I was elected as a president of the Shanghai Society for Cardiology. At that time, we have in Shanghai, we have more than 13 international conferences in the field of cardiology. As a president, I call all the members. I said, look, what we want to do, what the meaning of a congress or conference. And it means we have to promote, of course, the academical field, to study the new findings, to let people be trained. Well, if we have so many meetings that repeat the same thing and in a very short period, and sometimes in 1 month, I have to give 2 lectures, the same lecture to the same group of people. I said, could we maybe merge all the meetings together, and we make a bigger platform to focus cardiology, hypertension, basic research, heart failure, intervention. Then all the members, they did not disagree. They agreed. Then from the year 2005, we coined the meeting we call Oriental Congress for Cardiology. The first year was the attendance only, I think, 1,500 people, 1,500 people. The next year, 2,000. After more and more and more. And during this pandemic, we have some of the meetings online, virtually, but after pandemic, we are back. For example, last year, by the year 2020, or this year, 2025, we have 16,000 attendees, and we have invited a lot of international colleagues, professors to deliver a lecture to introduce the latest development in that field. And we have now more than 20 summit. Each summit focus. We have a summit the group leader or director to in charge of hypertension, imaging, intervention, and so on and so on. And everyone they're doing their well. And I think this is what happens in last years. Next year is the 20th anniversary of the OCC. Hopefully, we have more colleagues getting involved and to introduce new therapeutics for the patient.
Thank you. And what would be the theme of the next meeting in June?
Yeah, the theme, the OCC we call open. The first is open to everyone. The second is the C is cooperation, means we try to cooperate with different field, and the first equal. I forget. Sorry.
No, Junbo, that's not exactly what I meant. I meant, what do you have planned for the next OCC? What would be the main attractions?
Shanghai is a modern city, open city. It's like Paris, and people here they're academically very active. And next year, we do believe, based on the platform, I think we will invite more colleagues internationally to join this platform and to let this platform becoming the best meeting academically. And also, I think another important target is we let this platform to exhibit the newest, the latest development of drugs, instrument, and devices, and let the attendee to get information from this platform.
Thank you. And you already mentioned some of it, but what is your vision for the future of the OCC?
Yeah, I think the OCC, as I mentioned, we want to becoming the best platform for exchange our academic knowledge, and also becoming the best platform for the new device and therapeutics to be exhibited.
So thank you. Now we change subject again, because you run one of the largest departments of cardiology in China. Can you share with us the main highlights of your department?
Yeah, when I was called the department, we have 88 bed for cardiology, and we have a very small basic research lab. During last 20 years development, 25 years actually, and now, for example, we have a very big basic research unit. And since last year, I'm the director of National Basic Research Center for Cardiology. And we are the basic research focus on the pathogenesis of atherosclerosis. And we have a group for our fellows doing heart failure and myocardial protection and stem cell therapy. And most importantly, and we have a special group that doing innovation and transition. We are in this group. We are did a lot of innovations of the devices for the patient treatment. Clinically, we have now 420 bed for cardiology, for clinical cardiology. And we have a group, for example, focus on hypertension, on the coronary intervention, on heart failure, and on the structural heart disease. And I did the first tower in China in the year 2010, and 2 years after, I did the first mitral clip in China, and so on. Therefore, now we have a special group for structural heart disease. That means including our interventional cardiology and cardiac surgery. We discuss which method is best suitable for the patient and beneficial for the patient and less painful for the patient. The clinical cardiology and basic cardiology, we are together, but also sometimes they're doing their independent things and to find the problem, try to solve in the basic research lab.
Thank you. I really think, yes, for our young viewers, so it's important to stress how important it is to find the right therapy together with a multidisciplinary decision with the cardiologist and the surgeons. Really important. So please, Filippo, I leave over to you to ask the last questions.
Yes, Cecilia. I had the privilege of visiting your department during the last meeting at the Oriental Congress of Cardiology meeting, and I was really impressed by the remarkable organization, and also spanning from experimental cardiology to clinical cardiology, all under the same roof. And this is an important, really important achievement, because having patients and experimental labs under the same roof potentiates what you said before, to go from patient to the experimental lab and vice versa. Now, my question is about something you like very much, panvascular medicine. Can you tell us more, quickly, but more about panvascular medicine?
Okay, thank you. As I mentioned, my mentor, Professor Chen, he was the chief editor of internal medicine when I was in the medical school. And this book renewed every about 5 to 10 years. Yeah, now it's shorter. And from the 8th edition, I was the chief editor of the internal medicine. This book is universal for all the medical students to study. And I have been also the chief editor for the 9th edition, now the 10th edition. As a chief editor, you have to read every single sentence. By reading this whole book, even as a cardiologist, I'm thinking, hey, something wrong, because we have more and more patients. We have more and more, the hospital become bigger and bigger, and the people are not very happy. Finally, I found one thing. I think last years, the explosion of the fast increase of cardiovascular disease, including stroke, is one disease. It's vessel disease. Only it occurs in different places. In the brain, you have stroke. In the diabetic foot, you have to do amputation and so on. And therefore, in the year 2015, I wrote an editorial. I said we have to take the patient as a whole, not segmentally. And the pathogenesis actually is atherosclerosis. Only it occurs different places and causing ischemia. And we have to maybe do bypass, to do stent, to do intervention. Therefore, I think if we do our study or we do our device innovation to the upstream, I think maybe we spend less money and get more result, a better result. This is why I think in last years, I try to convince our people that we put this innovation together. Just recently, we just established one college we call OPIC, Oriental Panvascular Innovation Device College, and we try to develop or to create the wires, balloons, not only used for the heart, but also using for the other part of the body, for the cerebral vessels, peripheral vessels, and so on. Therefore, This is I try to call from a prevention to intervention to this rehabilitation. Take a vessel as a whole organ. To I think this would be we spend less money and get a better result.
Yeah, I agree with you. This is an important notion, and also uh, this holistic approach probably should go beyond the cardiovascular system, because the interaction with the diabetes and kidney disease and also liver disease and with the aging population, these interactions, the weight, the importance is more and more. So perhaps we have to combine together, on the one hand, there is very specialized interventional cardiology, but at the other extreme, an integrated approach to the holistic integrated approach to our not only cardiovascular system, but to our body at large. So I think that we are developing similar lines of evidence and research. I have one last question for you, and it's about this wonderful cooperation between Europe and China. In the last few years, we had these joint sessions in your Congress between the European Heart Journal and OCC, which have been really very well attended. What are your plans for the cooperation between EAC, European Heart Journal, and OCC and Chinese cardiology at large?
I think we encourage our younger fellows. They are I think to attend more international activities, to join the international multicenter trials. And for example, this year in Madrid, we have this European Society of Cardiology. The abstract came from China was more than 10% for all the submitted abstract. And we have a lot of fellows that came to present the result. I do encourage, in the future, that we have our, for example, teams that get their result either published in European Heart Journal, or for the younger fellows, they have their result presented during the ESC, and to promote the international collaboration. I think this is the future. You see, this year we have more than 1,000 people to come to attend, and now think after this pandemic, the international traveling make things easier, not like before. I think that for the people, especially for the younger generation, they understand English much better than our generation. Now that generation, we have one single digit, one single alphabetic to recite. Now they have this feeling. It is not necessary. They are first have Chinese and in the brain to translate English. They are speak just thinking in English. I think it's easier for them to get international change.
Thank you, Junbo. So the bottom line is more Europeans coming to China, more Chinese coming to Europe. We have a nice common language, which is available for all of us. We have a common enemy, which is cardiovascular disease, and we want to fight this battle against cardiovascular disease all together. Cecilia, President of ESC, what are your comments?
Well, thank you very much for your wise words, and I wish that we, on a part of the European Society of Cardiology, can learn from you, and maybe even a few words of Chinese. But that is a great challenge to us, I would say, of equal magnitude as that which you described. We are very proud and happy to be in partnership with you, and we look forward to the further progress of this collaboration that we so much value. So we are really very happy about the interaction and the collaboration.
Any last remark, Junbo, from you?
Thank you very much, Filippo. Thank you very much, Professor Linde. Actually, I really see from my own point of view, I am really grateful for I have been trained in Europe, and I learned from all of you that how to write a manuscript, how to present a slide, and my first presentation during ACC, I think in 91, and at that time we have prepared the slide one by one, and to know how to present scientific results. I think we have now in the future encourage our fellows to get involved to the international academically activity and to learn each other. And as you mentioned, our enemy is the cardiovascular disease, but we can also contribute to the worldwide, especially clinical trials. When in the future, if you have any multi-center clinical trials, we will be happy to contribute, to attend, and to get our patient also profit from the clinical studies. Thank you very much.
Thank you. It's been an enjoyable hour, very, very interesting, very productive. Thank you for this excellent dialogue. I remind our colleagues that the next dialogue will be on the last Thursday of November, and will be with Professor Ugo Cactus, and we will as you know, is a pioneer in the field of troponin. So will be a dialogue mainly focused on biomarkers. And again, Professor Cactus, as today, Professor Ge will share his human experience, not only scientific experience, his human experience with us, which is very inspiring. Thank you very much. Bye-bye.
Okay, thank you. Bye-bye.